Hi, my name is Brenda Morales. I work for the City of Brooklyn Park. I'm the Community Engagement Specialist for the city. And today we're having a meeting for the Brooklands Coalition. And the purpose of this meeting today is to bring local leaders, including community leaders, faith leaders, partners, nonprofits, to meet on a quarterly basis to talk about things that are important to their community. So today we're going to be talking about the new COVID booster bivalent, which is the newest booster that came out, and we'll have people from the Minnesota Department of Health and the Hennepin County Public Health to talk about the new COVID vaccine, the importance of it, and why people should get vaccinated. We also have staff from the police departments of the City of Brooklyn Park and the City of Brooklyn Center to talk about public safety and what is happening in the two cities. And then last, we have people from Hennepin County and CMRS, which is Community Mediation Restorative Services, to talk about rental and housing assistance and the evictions that are happening in Brooklyn Park and Brooklyn Center, and what the community leaders need to know about the evictions and what resources are available so that they can bring these resources to their communities.
Wonderful, Brenda. You already mentioned, but what kind of shortage or resources the community needs, you already mentioned. But the other thing is, as you know, for the last 3 years, we have been in a very serious crisis due to COVID-19. Mm-hmm. But as a community engagement specialist, what the people are asking most of the time, how is the people's involvement in terms of taking vaccine or getting some other resource at city level or what level? So is there anything you would like to say about it and how they can access any kind of things what you are mentioning? Because I see there are many papers in front of you where they can get like the information you told us. Can you tell us a little bit?
Yeah, I would say right now the number one need that I'm seeing in community is housing, whether that is eviction prevention, navigating the eviction court system, or rental assistance. A lot of people have fallen behind on rental assistance. So we're encouraging our community leaders and our residents to come to events like this to learn more about the resources that are available, or to call us and connect with us so that we can connect them with resources. We have a lot of connections with our partners at the county, in the community, and at the state level. So we're able to connect them. If we don't have the answers at the city, then we can provide those resources with one of our partners.
In order to give that information, where they have to go, what kind of numbers they have to use, what kind of website they have to use?
Yep, they can go to the City of Brooklyn Park city website, and we have resources on there. They can also reach out to me directly. My phone number, I don't have my phone number listed, memorized, but they can call me directly, and we can, our team can always help and connect them to other resources in the city or in the county as well.
All right, wonderful. Before I'm going to wrap up, as a community engagement specialist of City of Brooklyn Park, is there anything you would like to deliver for the larger community in City of Brooklyn Park? Because we have a diversity here, so even you tried to invite many diversity at the same time. So is there anything you would like to convey by using this chance on Oromo Diaspora Media?
Yeah, I would just say for the community to know that the city cares, that we want to work with you, we want to partner with you. If there's opportunities where you think that the city could be a good partner for an event or an activity or something that you all want to promote, reach out to us. We're more than happy to connect with you. We want to connect with the Oromo community and all communities, and really just connect with our residents and let them know that we're here to work with you, to work alongside you, because we are also part of the community and we really care to improve the community and the well-being.
All right, thank you very much.
Thank you.
You can tell me your name and your responsibility in the City of Brooklyn Center.
My name is Armando Oster. I am the Community Engagement Specialist for the City of Brooklyn Center.
Wonderful. Today there is a kind of gathering which you guys invited different community members. What's the point of gathering these individuals here in this building?
Well, today it marks one of our quarterly meetings, so we meet 4 times a year now. It used to be monthly, especially during the last 2 years during COVID. The coalition is really organizations from Brooklyn Park, Brooklyn Center, the City of Brooklyn Park, City of Brooklyn Center, and ACER of Brooklyn Park really organize the meetings for everybody to come together. It's a really good opportunity for community to get involved, meet local organizations that can really help your community.
Good. Especially as a community engagement specialist, residents of City of Brooklyn Park or City of Brooklyn Center, what kind of challenges they are facing during this COVID-19 time?
There are a lot of challenges. One in particular, obviously, COVID-19. I think, dispelling myths in community about the vaccine, what it is, its efficacy, how well it works, was a big challenge, especially for our BIPOC communities. Housing, rent, prices are going up. Interest rates are going up. People's monthly mortgage is getting more expensive, and they're not able to pay as they were before. So housing has been a really big concern. Really, over the last year, we've heard more from community about that. And then just general public safety, especially in Brooklyn Center. That's been ongoing for some time.
Wonderful. So this gathering or this meeting can give a kind of highlight for it or some input for sure, as you guys mentioned. But if anyone faces some challenges in terms of public safety or rental issue and there's others, is there a way they can meet you guys? Do you guys have any kinds of using website or phone number? How they able to reach City of Brooklyn Center?
So the great thing about these meetings, we invite community organizations here to present on the topics that we just talked about. So for public safety, we have Commander Fleslin from City of Brooklyn Center, for example, here to present, give you updates, and he is the contact person for police department. I am a general contact for the City of Brooklyn Center. So if you're a resident of Brooklyn Center and you need anything, you can contact me. My name's Armando Oster. Again, I'm the Community Engagement Specialist.
All right, thank you. I appreciate it, man.
Hi everyone, I'm Danae Yancey. I'm a community health worker with Hennepin Health, or not Hennepin Health, but Hennepin Public Health. And I work with Abby here, and I also work with the planning team, but I'm mostly working with Brooklyn Center and Brooklyn Park Health on the go.
Hi, good evening everybody. I'm Abby Zeller. I'm also with Hennepin County Public Health. It's nice to be here in person.
Hi everyone, thank you for having me. Buenas noches, my name is Ray Ruiz. I represent Bass Tech Fishing Outdoors. I live right down the street. Always wanted to come to this building. I know Armando, thank you for the invite. We met some really nice folks here. Thank you very much for the invitation. It's a pleasure to be here.
Hey everyone, my name is Layla Hussein and I'm the Community Health Manager at CAPI. So welcome. I'm really glad that you're all here in the building. It's really great to host you and to see all your faces.
My name is Sarah Silva. I'm a Community Health Navigator here at CAPI. And I've been here for about 7 months, so this is my first coalition at CAPI, so nice to see everyone.
Hi everyone, my name is Will Lucker. I'm the Housing Stability Lead here at CAPI USA, focusing on programming for rental stability, advocacy, homelessness, and public policy advocacy.
Hi, this is Ika. I'm the CEO at CAPI, and I've been with CAPI for 15 years. It's quite old. Welcome to CAPI, and we're excited, and I've been exchanging emails most of the time with my team, but this is my first meeting with the collaboration, so welcome.
Hello everyone, my name is Mei Lee. I am the Community Health Lead here at CAPI, and it's just great to see everyone all congregate and be able to see familiar faces here tonight.
Hi everyone, my name is Sage. I'm with the CEE with the Workforce Development Team. I'm a building science trainer.
Hi everyone, my name is Sarah Northrup. I'm the Workforce Program Manager over at CEE. I work with SAGE, Center for Energy and Environment, and just excited to be here and get to share more about the work that we're doing.
Good evening, my name is Garrett Fleslin with the Brooklyn Center Police Department. I'm one of the commanders, and I'm actually going to be presenting in a little bit, and I'll introduce myself more then.
Hey, good evening everybody. Bill Barrett, I'm a Deputy Chief with Brooklyn Park, overseeing our investigations, mental health, and community engagement division, and I too will be doing a presentation with Mr. Fleslin next door to me.
Hi everybody, this is Hulda Hiltsley. I am a resident of Brooklyn Center, community leader I guess, with the Kenyan immigrant community. I ran for state senate, lost in the primaries, but that's all right. But it is so good to be here. We've been in this work, doing this work for, at least for me, for about 2 years now, and it's finally good to actually be in communion together and in fellowship together, so excited to just move forward.
Hi, I'm Edward Arias. I am the Community Relations and Outreach Director for United Healthcare Community Health Plan.
Good evening, everyone. My name is Brenda Morales. I'm the Community Engagement Specialist for the City of Brooklyn Park.
Hello, everyone. My name is Claudia Diggs. I am the Equity and Housing Director for Community Mediation and Restorative Services, and I'll tell you more about our programming coming up.
Hi, everyone. My name is Carmen Viviano. I am a community engagement specialist. I oversee the health on the go with the City of Brooklyn Park.
You should introduce yourself.
Oh, sorry. Hello, my name is Siticha. I'm from Oromo Diaspora Media. I'm originally from Oromo. Nice to meet you guys.
Hi, everyone. My name is Patricia Aguilar, CAPI's Financial and Home Ownership Service Manager.
Hi, my name is Victoria. I am the Executive Director for Legacy Family Center. I'll tell you more about what we do.
And I should have started with this, but thank you so much, Kapi, for hosting us today. I feel we have worked a lot together, but this is the first time I've seen your office in person as well, and it's such a great space. So thank you so much for that. And welcome everyone who has joined us in hybrid. Collins, do you want to go and introduce yourself? Yes, hi Cecilia. Yes, go ahead.
Hi, everyone. I'm Cecilia Calabria, the Health and Wellness Director at COPAD, Communities Organizing the Power and Actions of Latinx.
Think you might not be there. It's okay. We can go ahead for the first thing on the agenda. We invite Mary Ziong from MDH to do a quick update on COVID-19 and the bivalent boosters.
So again, my name is Mary Zhang from MDH. Part of my work in our COVID response is to provide the equity and engagement with community members. And so the information I'm going to share will briefly cover bivalent booster, as well as just community resources so that you know where to access a lot of our vaccine sites and then be able to share within your communities. So you all have heard that recently, throughout just a couple months, we've launched the bivalent booster. So these are just some of the background around our COVID-19 bivalent booster. It is a protection against the current Omicron strands that is circulating and still getting people sick. It does also contain the original legacy strand of the COVID-19 virus as well. So that's why we, behind the research, it is now known as the bivalent because it contains two components of the spike strands that make people sick from the COVID virus. So currently, the EUA has been approved, and so the monovalent, that was the current booster, the previous booster is no longer active. So then now whenever you go to a clinic or to your clinic or your healthcare system, you will now only be able to offer and get the bivalent booster. CDC also recommends that everyone now ages 5 and older can get the bivalent booster. So this is like still very new information. Yesterday, the FDA and CDC did recently just approve the bivalent booster for children. So this is exciting because before the bivalent booster was only offered for children, and then adults received the bivalent, and now we have the bivalent for children as well, ages 5 years and older. The main purpose of the bivalent booster is to really provide that extra protection. We've been sharing and we've been monitoring how people's protection wanes off over time. And so this really is to add an added protection so that throughout a certain time, people can maintain their antibodies and still protect themselves from getting severely sick from the COVID virus. So all vaccines right now are currently safe and effective. And we are still just always making sure that people are up to date. And by that, they would have received their primary series, which would be the first and second dose, and then the booster. And so, you can go next. And so that eligibility really is to encourage people to get their primary series so that they would be eligible for the bivalent booster. Right now, again, like I shared, children recently became eligible. So for Moderna, it is 6 years and older. The good thing about Moderna that we are also just recently sharing is that Moderna's bivalent booster is the same dose for adults and children, the same type of vaccine, but the doses will just differ based on the age. And so for Pfizer, the vaccine products are different for the different age ranges. And for Pfizer, it is 5 years and older, 5 to 11. So if people have preferences on the different type of vaccines, those are just kind of some of the differences between vaccines. But know that children now can get the bivalent booster. And so with the recent FDA EUA approval, there are no more monovalent boosters. All of the boosters now are bivalent. Next. This is just a little bit more of that detail. I will be sharing this slide with everyone as well. So there are some really good links in here that you can as well access. So if anyone wanted copies, you expect that you will get this at the end of today. But this is just a little bit more detail into the children's bivalent booster. So you can see just the age range and the dosage for Moderna, and then also the Pfizer for the different age range as well. We are expecting that for children's boosters, some pharmacies that are partners with the federal will receive their first shipping this weekend. So they usually can expect to vaccinate much earlier than health systems. Health systems will take about 5 to 7 days until they're prepared and they can operationalize their system so that they can start vaccinating. So for some pharmacies, they will start vaccinating as soon as this weekend. These are just some updates for what we have statewide. So you all know we have some state vaccination sites that we offer for community members. These are ways that we can provide no barrier resources for people. So we have set up the Mall of America, Duluth, Moorhead, Rochester, and our most recent Midway that started middle of September that offers the bivalent booster for adults. And so as we incorporate more children bivalent booster into these sites, people should be able to go online through the links directly and sign up for an appointment and be able to select which location is within their region. Next. This is also just another resource tool. We are still in the middle of updating our vaccine finder tool so that it would include children's vaccination all across the state. But if you do run into anyone who is interested and don't know where they could find a vaccine clinic, they can use our vaccine finder tool and access any type of vaccine, or if they want to look through clinics that offer different types of vaccines for children, they can use the filter tool and then also find where is the clinic that's closest to them. Next. And then these are just some resources that we are still in the middle of also updating. These are just materials that you can also download and share to your community members or friends or family. We have a variety, so you can see anything from children to in-home vaccination. In-home vaccination has been one of our biggest resources, especially for people who are not able to leave their home for any reason. They could access this program and get that service right to them at their home. We also have our public hotline, which it's been in the community. It's still a resource. And then we also have our COVID community coordinator contractors who, CAPI is also one of the contractors that we've been a part in this COVID response. And these are some of the partners that we work with that would provide community clinics for vaccination, as well as testing and other resources to help people. And then just know that we have continued to provide updates for our data dashboard that anyone can go and track our progress on vaccination. All right, so lastly, we are still collecting stories. Stories has been one of the biggest inspiration for people to share the reason why they want to get vaccinated or why they have chosen to get vaccinated in the first place. And so this is one of our campaigns that we're still collecting stories for. For this purpose, we are collecting stories for anyone who has gotten their bivalent booster. so that we can share that across the state through our social media website, just to let people know, what is another perspective, why people chose to get vaccinated. So if you know of anyone who has a really cool story, or if they have something that they want to share, please submit that into our campaign, and we will share that story across the state too. All right, that's it. That was really brief, and so again, this is my email. You can contact me, and I will hang around for any questions. Thank you.
Thank you.
So it's a great question. There's very few agencies in the state of Minnesota that's doing a true co-responder like that. I am literally meeting with the Criminal Justice and Behavioral Health Unit next week to talk about finding a social worker that will work in that type of position. I've been told that there's a shortage of mental health workers in the field. So we actually created a job description and all that stuff there. We plan to see that this is the model that we are going to go with in Brooklyn Park. We have the funding for it. We're going to kind of do it in that three-pronged approach. When I talked about the embedded social workers, the alternative response, does everybody know what that is?
No.
It's social workers with community paramedics. So when a call comes into 911, the Hennepin County dispatcher, in this case, Hennepin County dispatcher, will vet the call and find out if that is a call that alternative response can go to in lieu of the police. That would be phenomenal. Okay, so that is going to get going. It's going to be
citywide or countywide?
This is going, well, there's other jurisdictions in Hennepin County that are doing it, but we are one of the agencies, and Brooklyn Park is going to be one.
I have a comment. You talked about what the police department is doing. You talked about this public safety and public community policing, right? We also have to note that it has to be a community-centered approach as well, and that means that the community, as residents, as community leaders, as organizations, we also have a part to play in it. If we're talking about sustainable change, if we're talking about sustainable solutions, us as community members, residents in whatever city we live in, we also have to know that we do have a role to play in it, and not just say, yes, we're going to keep our police accountable, we're going to keep this accountable, but then what about internally us as community leaders, as community members, residents, and organizations who are trying to build a thriving community? It has to be a two-way street, at least from my perspective too. So what does that look like? It has to be us in here having conversations like this to talk about, all right, this is exactly what policing looks like, where is this collaborative efforts between this department, the city, and the community as well as a collective.
Couldn't have said it better.
Yeah.
Thank you. I want to be respectful of time. I know that I could probably sit here till 8, 9 o'clock tonight and answer questions over and over and over again. So I do see somewhere.
And we do have questions at the end.
Right
so
here.
if you have questions, please
so we can come
jot
back.
them down, and we will have some time at the end for
What kind of training you guys are providing?
Hi, my name is Sarah Northrup. I am a workforce program manager. I work at the Center for Energy and Environment, and the kind of training program we have, so it is a funded, it is a paid 5-week train where you can earn $2,500 and also have the opportunity to earn a industry recognized credential known as the Building Science Principles Certificate. And this can help you get into a wide variety of jobs that are really fast growing and help you to start a new career if you're looking to start a new job. It's a great place to start. The training starts on November 14th, but you need to sign up by November 7th. You can go to our website at mncee.org/job, JOB-training, TRAINING, or just Google
All right. Well, actually, I got you prepared. My last question, what are the preconditions to be enrolled in this training? Is there some requirement for it?
Yes, you need to be 18 years old. You also need to be a lawful permanent resident of the United States, or be able, actually, no, sorry, backtrack that. You need to be able to, you need to be authorized to work in the U.S., and you need to be able to have a 5th grade reading and math ability in English.
Good. That means this job is a part-time job or it's a full-time job?
You will have the ability to be able to enter into full-time or part-time work after this 5-week training. The internship program that runs for 4 months, that is also paid after this 5-week training, is full-time, about 35 hours a week. You become a temporary employee at CE with more opportunities to further your credentials and to further your career.
Just tell me your name and what kind of announcement you did before.
Okay. Hi everyone, my name is Sage Berglund. I work for the Center for Energy and Environment, and I want to tell you a little bit about the Home Energy Squad.
Okay, I think you guys were telling how people can save the energy and the amount of money they are paying on their bill. Can you tell us a little bit about that?
Yep, so you go to the Home Energy Squad website, sign up for it, and then either a group of people or one person will come to your house, do a complete house assessment, look at the attic, look for insulation in the walls, look at the furnace and the water heater, make sure everything is operating like it should. Then they'll do some tests on the house, make sure it's tight and you're not losing energy, and then they can do installations. So putting in light bulbs, putting in weather stripping, anything that'll save you energy.
Good. That means the amount of bill they are paying is different from what they are paying at this moment?
Yes, exactly. Our goal is to help you save energy, which means to save money.
All right. Thank you. Appreciate it.
Thank you.